Welcome, everyone. So, if you or a loved one are gearing up to leave the hospital after a procedure, you probably know exactly how daunting that moment can actually feel. The doctors give you a thumbs up, the nurses hand you this massive stack of discharge papers, and suddenly you're entirely responsible for the whole healing process. Honestly, it can feel a bit like you're being dropped into the wilderness without a map. But don't worry, because that is exactly why we are here today. In this explainer, we are going to completely demystify the home recovery process. We're using official medical guidance from trusted sources, like the American Academy of Orthopedic Surgeons and Medline Plus, to take that heavy stack of paperwork and transform it into a clear, actionable guide you can actually use. But first, I really want you to ask yourself, are you truly ready for the journey home? And I mean mentally ready. I want to validate something right out of the gate here. Surgery, even when it goes absolutely perfectly, is a controlled trauma to the body. Your system has literally been through the ringer, and feeling anxious about stepping away from around-the-clock medical care, that is completely 100% normal. However, what we know from the data is that being prepared with the right information drastically reduces that anxiety. When you know what to expect, and more importantly, exactly how to respond, that fear is replaced by pure empowerment. To keep everything straightforward, here's our roadmap for today. 1. The road to recovery. 2. Managing your pain. 3. Spotting warning signs. 4. Mastering mobility aids. And 5. Taking your next steps. No overwhelm, just 5 distinct, easy-to-digest chapters. Okay, Section 1. The road to recovery, your transition home. Let's dive right in. Our overarching goal right now is to translate clinical recovery data into actionable steps that you can actually use in your own living room. The transition from a hospital bed to your own bed is literally the most critical phase of your recovery. So to ensure a safe transition home, we're going to empower your recovery by focusing fiercely on 3 foundational pillars: pain, warning signs, and mobility. Think of these as the 3 legs of a stool. If you understand how to manage your discomfort, how to keep yourself safe from complications, and how to physically move through your environment, well, that stool is going to be incredibly stable. Sticking to these pillars will empower you to safely and confidently navigate your daily reality at home. Moving on to Section 2, managing your pain, the internal experience. This is a big one, guys. It is so important to adopt a healthy mindset here. The official guidance frames pain medications not as some magical cure-all that will erase every ounce of discomfort, but rather as a crucial toolkit. The goal of this toolkit isn't zero pain. It's to reduce the pain just enough so that you can actually participate in your rehabilitation and get some solid rest. To do that, you need to know exactly what's inside your kit. On one side, we have opioids. These are the heavy lifters. They're prescribed specifically for acute, severe pain management, usually right after you get home. But they come with side effects and risks, meaning they're meant for short-term use only. On the flip side, we have NSAIDs, like ibuprofen and acetaminophen. These are your foundational tools for reducing inflammation and managing mild to moderate pain. They work entirely differently in the body by targeting swelling right at the source. Now, what's really interesting here is how pain management is essentially just a matching game. I mean, you wouldn't use a sledgehammer to hang a tiny picture frame, right? In that exact same way, using the right tool at the right time helps manage your pain safely and effectively. For severe breakthrough pain, yeah, you might need the opioid. But as the days pass and the pain turns into more of a dull ache or stiffness, you transition to the NSAIDs to control the underlying inflammation. Understanding this transition is the absolute secret to weaning off heavy medications smoothly, all while keeping your pain totally manageable. All right, Section 3. Spotting warning signs. External physical threats. We need to shift gears for a second and be incredibly precise. A major source of anxiety for patients recovering at home is simply not knowing if a symptom is just a normal part of healing or if it's a critical issue. We are going to clearly delineate that right now using Medline Plus data. First, we need to define what a true medical emergency actually is in the context of post-op recovery. Think of a medical emergency like a dashboard engine light in your car. It is a critical warning sign from your body requiring immediate professional medical intervention. We really need to clarify this so you aren't constantly panicking over normal post-op discomfort, like a bit of tiredness or soreness. Instead, you'll know exactly when to pick up the phone and get professional help. So, the absolutely crucial point here is that you must memorize these specific red flags. If you experience a sudden fever, notice excessive redness expanding around your incision site, or see a sudden, severe increase in swelling, especially in your legs, which could indicate a blood clot, your body's check engine light is officially flashing. Other signs of infection include increased warmth around the wound or any unusual drainage. If any of these specific symptoms pop up, you do not wait it out. You don't sleep on it. You contact your doctor or head to urgent care immediately. Knowing these red flags means you never have to guess. Which brings us to Section 4, Mastering mobility aids, interacting with the world. Okay, so you've got your pain managed and you know the warning signs to watch out for. Now let's talk about actually getting up and moving around. Mastering mobility aids is all about how you interact with the physical world. The American Academy of Orthopedic Surgeons has fantastic, specific guidance on how to safely use canes, crutches, and walkers. Because using them wrong isn't just tiring, it's potentially dangerous. Let's break down the actual mechanics for a walker into actionable physics. Step 1. Position the walker a short distance in front of you, making sure all 4 legs are firmly on the ground. Step 2. Step forward with your weaker or operated leg first, placing it right into the center area of the walker. Why? Because the walker is literally there to share the load with that weak leg. Step 3. Push down on the handles for support and bring your strong leg forward. It's an incredibly deliberate rhythmic process where you use your upper body physics to protect your healing lower body. And this brilliantly illustrates our core philosophy today. Proper body mechanics are the foundation of safe and effective rehabilitation. It's not just about owning the walker, it's about using it as an extension of your own body. Utilizing these tools correctly prevents falls, protects your surgical site, and dramatically accelerates the overall success of your physical therapy. You are quite literally training your body to move correctly again. Finally, Section 5. Taking your next steps, the road ahead. Let's tie this all together. We've covered the internal experience of pain, the external threats of complications, and the physical reality of moving around. And if you take nothing else away from this explainer, always remember this fundamental truth. Recovery is a marathon, not a sprint. Healing takes time, and honestly, your body dictates that schedule. But as we've seen today, your patience and your preparation are without a doubt your greatest assets. By mastering your pain toolkit, vigilantly spotting those red flag warning signs, and using your mobility aids with perfect mechanics, you aren't just surviving the recovery process, you are actively mastering it. You are fully equipped for the road ahead. Which leaves us with one final, very important thought to consider as you go about the rest of your day. What active role will you take in your healing today? Will you organize your medication toolkit right now? Will you practice your walker mechanics in the living room? The power is entirely in your hands. Thank you so much for joining me for this explainer. Stay focused, stay patient, and here is to a very smooth and highly successful recovery.